Alrighty, here we go. Hello, and thank you for watching this program on CPT and ICD-10 code pairing. There's no audio taping or video taping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not intended to substitute your thorough clinical decision making. It should not be construed as any written policy for any federal agency. It's not intended to be legal advice. Target coding does not engage in providing legal services. When we talk about CPT codes, just a reminder, CPT is a registered trademark of the AMA. Every attempt has been made certain to make sure that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going. My name is Dr. Marty Kotler. I am a chiropractor. I'm also certified in CPT coding. I'm a certified professional compliance officer. My areas of expertise include CPT coding, HIPAA compliance, documentation, creating compliant care plans, creating compliant cash plans, how to manage care, and Medicare. I've written many books and training manuals on compliance and documentation. I write articles for Chiropractic Economics and Dynamic Chiropractic. I'm a featured speaker for the Coding Institute, Parker Seminars, and Foot Levelers, and I'm a guest speaker at many state association conventions nationwide. For those of you listening to this presentation that you're a part of your state association looking for a speaker on coding, compliance, documentation, let us know. Maybe we could work something out. I can typically get someone to sponsor my events. Okay, so let's start off with the CPT ICD-10 code pairing basics. To begin with, CPT stands for Current Procedural Terminology. Those are your procedure codes, like your chiropractic adjustments, your therapies, your examinations, x-rays. When you report those services, you're going to use CPT codes, procedure services. ICD-10 stands for International Classification of Diseases. We're up to the 10th edition or revision. And those are your diagnosis codes. Make sure not to confuse the two. There's actually a third set of codes. Those are called HCPCS codes. Those codes typically begin with a letter. HCPCS stands for Healthcare Common Procedure Coding System. And those codes are typically for durable medical equipment like orthotics and TENS machines and back braces. So back to CPT codes and diagnosis codes. For every procedure code, again, like a chiropractic adjustment or traction or therapeutic exercises, those procedure codes must link or pair or be supported by a corresponding diagnosis code. That's what we call CPT ICD-10 code pairing. Some people call it linking, code combining, code matching. I like to call it code pairing. Now, your state scope of practice and your state practice laws, your standards of practice in your state, and health insurance companies, they all require that your procedure codes and diagnosis codes have validity, and they could be justified in your documentation. The rationale for choosing a diagnosis must be entered into the patient record and be part of a care plan, even for cash patients. See, this presentation is not only about insurance reimbursement, it's about preventing malpractice, it's about risk management, it's about preventing state board issues. You want to be able to justify everything you do, just in case you're questioned, even on cash patients. Cash patients can file complaints against doctors. Cash patients can sue you for malpractice, so this is about protecting your practice and making sure you're choosing the right codes and being able to justify them, just in case you're questioned. Other basics here are the diagnosis must be extremely accurate. You always want to use diagnosis codes to the highest degree of specificity. And don't guess or gamble. For example, if a patient comes into the office with low back pain, radiating pain and numbness down a leg, don't automatically assume this is a herniated disc. I know those of you in practice for many years, you could probably pick up a lot of things without expensive diagnostic tests. Just be careful. A diagnostic test may be appropriate to rule out or rule in disc pathology, and you're probably going to come across codes, diagnosis codes, when you're looking at your drop-down list. Some people call it cheat sheets or quick guides, your favorite list. You're going to see some diagnosis codes that say disc disorder and some say disc displacement. Make sure you know the difference. Let me share that with you. So here are some codes here. You have cervical disc disorder and you have cervical disc displacement. What's the difference? Most of the doctors that I speak to on this topic are not able to quickly tell me the difference. So cervical disc disorder means that there is some sort of disc pathology. There's some disc involvement, whether it be a herniation, a bulge, a protrusion, a prolapse, and there's nerve root compression, which means there's radiating pain down an arm, in this case, or down a leg. So that's disc disorder with radiculopathy, disc pathology with radiating pain. Disc displacement, as you see on your screen, cervical disc displacement without radiculopathy, without myelopathy, means that there's also some sort of disc involvement, like herniation, bulge, extrusion, rupture. But there's no radiating pain. There's no nerve root compression. And there's no myelopathy. Myelopathy is cord compression. So make sure you know the difference. Just like if you went to a doctor, you would want to get the proper diagnosis placed in your record. Do the same for your patients. You always want to code to the highest degree of specificity. Oh yeah, here's on the next slide, just a quick update, the difference between a disc disorder and disc displacement. Disc disorder with nerve root compression, disc displacement without nerve root compression. And you've probably seen this. I saw it in practice. Patients would come in and say, "Doc, I've had low back pain for many, many years. Finally went and had an MRI. So, Mr. Jones, do you have any pain radiating down into your legs, numbness in your legs, tingling?" "No, it's localized right in my lower back. I had an MRI, Dr. Kotler. Here's the results. I have an L5-S1 disc herniation." Well, that would be a disc displacement. There's no radiating pain. The MRI didn't show any cord compression. So when I throw out some of these terms like radiculopathy, myelopathy, radiculitis, I oftentimes get questions. So just want to share with you that this is a common question I'll get, like, what's the difference between radiculitis, radiculopathy, myelopathy? So if you're not sure, brush up on some of these terms. Radiculitis refers to inflammation of the nerve root. Radiculopathy is radiating pain where there's nerve root compression. Myelopathy means that there's some cord compression. And typically these things, well, myelopathy, you would need an MRI or a CT scan. So now getting back to justifying your CPT codes, let's start off with some CPT code justification. How do you do that? Well, there are modality CPT codes. There are two types of modalities: supervised modalities and constant attendance modalities. Supervised modalities is the application of a modality that does not require one-on-one contact by the provider. Example, 97012, mechanical traction. Those of you that offer mechanical traction in your practice, you could set the patient up on traction. Now, who can set the patient up on traction? That's a state-specific scope of practice issue. In some states, chiropractic assistants cannot set the patient up on traction or turn the machine on. In other states, they can do it. So make sure you know who's considered a qualified healthcare professional versus a clinical staff member who could perform the service, who's not allowed to within your scope. So mechanical traction, 97012. Set the patient up on traction. You could walk away. You don't have to stay with the patient. The definition of the code says it does not require one-on-one contact. It's also not a time-based code. Set the patient up on traction. You could stay in the room if you want. You don't have to. You could actually walk out of the room and leave the patient alone, unattended, it's okay according to the description of this code. If you spend 10 minutes, if the patient is on the traction table for 10 minutes or 20 minutes or 30 minutes, as far as reporting, one line item, one unit. And then we have constant attendance modalities. This is the application of a modality that does require one-on-one patient contact, so you need to stay with the patient the whole time. Example would be ultrasound, 97035 ultrasound. So any code that does require one-on-one contact, those can be billed in units. So here's how you start justifying. I'll start with one example here, mechanical traction. If you're going to be performing mechanical traction on a patient and you get questioned by an insurance company, a state board, a malpractice case, so Dr. Kotler, why did you do traction on this patient? Hopefully you have a good answer. If you say, well, it makes the patient feel better, or you have some vague answer, it's not going to look good. It could hurt you. It could work against you. Have some good answers. For example, look at your screen. You're better off saying, well, we use mechanical traction to stretch and separate the spinal segments. We use it to promote distraction and gliding of the joint facets. We use it to help promote joint hydration. So if you're going to use traction to stretch the spinal segments, then what should the patient have a lack of? Yeah, they should have a lack of mobility in those spinal segments. They should have a lack of hydration. So that's how you start justifying your procedure codes, through the verbiage. What is the description? What's the purpose? What's your intended outcome when you perform one of these modalities? Now let's switch to therapeutic procedures. Very different now. Therapeutic procedures, the application of clinical skills that attempt to improve function, one-on-one patient contact required. These are time-based codes. One of the common examples, 97110, therapeutic exercises. So how do you justify therapeutic exercises? If your question, hey, Dr. Kotler, we see that you're billing us for therapeutic exercises. Why are you doing it? Well, have some good reasons. Well, we use it to develop strength, endurance, range of motion, flexibility. So if you're going to use therapeutic exercises to increase range of motion, what should the patient have a lack of? You got it, range of motion. So exercises could be performed either active, active-assisted, or passive approach, reasonable for restricted motion, strength. I like to use this acronym called SERF, S-E-R-F. S stands for strength, E, endurance, R, range of motion, F, flexibility. You want to make sure you're improving one of those. Document the reason why the patient needs it. Now let's move on to ICD-10 justification. If your question, hey, doc, how did you come up with this diagnosis? Do you have a good answer? Would you be able to answer the question? Hopefully, yes. Here's an example, sacroiliac sprain. Sacroiliac involvement. Very common in chiropractic practices. Sacroiliitis, sacroiliac subluxations. So let's say you diagnose a patient with sacroiliac sprain. It's pretty common. Ligaments around the sacroiliac joint get sprained. So let's say you submit this diagnosis, and then you get a call from an insurance company case reviewer. Hey, Dr. Kotler, we see you diagnosed sacroiliac sprain. Can you explain to us how you came up with that? What would you say? Hopefully you'll say something like, well, the patient came in with pain in the SI joint. Orthopedic tests included Yeomans and Ganslins. And, even if you're not big on ortho and neuro and these types of tests, I recommend you do them, especially in a malpractice case or state board issue, because there are certain gold standard tests. Like I speak to some chiropractors, they go, Marty, I don't even own a stethoscope. I don't use a reflex hammer. They're more, maybe what we call maybe subluxation based, or they don't feel it's necessary. Oh, okay, I respect that type of practice. However, if you have an issue and your question, hey, why did you diagnose, or how did you diagnose this problem? Let's say sacroiliac joint, go Yeomans, Ganslins, some gold standard tests, Knockless. Hopefully you remember some of these way back in chiropractic college. The chiropractic findings included SI joint palpatory tenderness, hypomobility, hypertonicity. Maybe we took x-rays to rule out SI joint pathology. Here's another one. Let's say you diagnose a patient with cervical radiculopathy. Now your question, hey, Dr. Kotler, how did you come up with this diagnosis? Hopefully you'll have a good answer. For example, the patient had pain radiating into an upper extremity, some numbness, Jackson compression, shoulder depression, spurling. A couple of ortho tests will help you justify these things. Check reflexes. There was some myotomal weakness, dermatome changes, limited range of motion, subluxation, palpatory tenderness. So hopefully you have some good reasons and you can justify when you come up with a diagnosis how you came up with it. If you don't know how you came up with it and you're just robotic and you're just checking off codes without knowing why, it can come back to hurt you. So there's a book that I recommend. It has about 25 or so of the most common diagnosis codes in chiropractic, and it provides you with the subjective ortho, neuro, chiro, and imaging tests to help support the code. So this is an excerpt of the book. All right, now let me start giving you some specific examples on how to code pair. And I look at code pairing like, pairing food with wine. Going to wine and food festivals is one of my favorite things to do. I like to learn about how they combine and how to enhance the experience. So I look at food and wine pairing like CPT and ICD-10 code pairing. So we have mechanical traction. Why are we going to do mechanical traction? I just gave you the reasons. So mechanical traction, that pairs beautifully with cervical radiculopathy, M5412, and M5136, lumbar disc degeneration. Why am I saying that? Based on the definition of these codes. What's wrong with the patient? And what are we going to do to help the patient? Next, therapeutic exercises 97110. That pairs beautifully with sciatica, with low back pain on the right side. That's M54.41. Neck pain, M54.2. How about shoulder stiffness, left side shoulder stiffness, M25.612. Patient says, hey, Dr. Kotler, I have shoulder stiffness and I have shoulder pain. Well, what's my goal? My goal is to improve range of motion, decrease stiffness, increase motion. Diagnosis, M25.612. That pairs beautifully with therapeutic exercises. What's therapeutic exercises? I'm going to use it to increase range of motion. See, there's the connection. How about a right side quadriceps muscle strain? That's S76.111. Now there's a little underscore there because if you're familiar with S codes, you have to have a 7th digit extender which designates the encounter. Is it initial encounter, subsequent encounter? Here's another one. 97112, neuromuscular reeducation. The purpose of that code is what? To improve balance, coordination, proprioception. So there's the justification. So the patient should have a lack of one of those things when they come in. Now, neuromuscular reeducation with some insurance companies, they say, well, the patient has to have some sort of advanced neuromusculoskeletal disorder like multiple sclerosis. Well, some companies say that. Others don't require that. I see some insurance companies, they're okay with a patient having something like a sprained ankle. There's the code S93.411, one of the most commonly ligaments that is sprained in an ankle injury is the calcaneofibular ligament. So S93.411 is sprained ankle, specifically the calcaneofibular ligament on the right side, and you want to do some neuromuscular reeducation to increase the proprioception from the ankle up to the brain. Little clinical stuff you should check into. How about unsteadiness on feet? Neuromuscular reeducation. Again, it's used to improve balance and coordination. Patient has vertigo, dizziness, R42. Unsteadiness on feet, R26.81. There's a nice matching. How about lumbosacral radiculopathy and neuromuscular reeducation? That can pair very nicely. That's M54.17. Again, you have to check with all the carriers you bill to see what their definitions and their policies, specifically payment policies, on each one of these procedures. Next, manual therapy, 97140. Manual therapy, again, what's the clinical rationale for applying manual therapy? Well, it's used to stretch, shorten connective tissue. It's used to increase, facilitate fluid exchange. It could be done with myofascial release or manual traction, soft tissue mobilization. There's a few terms. So if you're going to use manual therapy and the patient has myofascial pain syndrome, there's a nice pairing. Patient has a lumbar herniated disc without radiculopathy, M5126, or bursitis of the right hip, M70.71, pairs beautifully with 97140. Next, patient presents to the office with a frozen shoulder, also known as adhesive capsulitis, and you want to perform therapeutic activities. There's a nice pairing. Therapeutic activities is used to improve functional performance. So a patient might come in and say, hey, Dr. Kotler, I love to play tennis. I have a bad shoulder. It's really acted up right now. I could hardly move it. With therapeutic activities, the purpose is to improve some sort of activity of daily living. That's why there's a big difference between therapeutic activities and therapeutic exercises. So 97530, some people call it the ING code because whatever you're doing, it has to improve bending, lifting, reaching, carrying, throwing. So in this example, the patient is playing, let's say, tennis or playing baseball and needs to throw a ball, but they have a frozen shoulder. And you're going to do some exercises to increase the functional performance. It's a multi-parameter code. There's a nice pairing. C5, C6 disc disorder. So that's maybe a bulge or herniation with radiculopathy. Low back pain, simple low back pain and therapeutic activities pairs nicely. Lumbar stenosis, M48.06. You can link that with 97530. All right, now let me give you a few clinical examples on how this works actually for reporting purposes. Here's an example, a group health plan. Mary patient comes in and we have in box 21 we have the diagnosis codes, and then in box 24D we have the CPT codes. So we want to pair them via the use of pointing. So take a look at the service 98940. That's a chiropractic adjustment, 1 to 2 regions. So where are we linking that with? What diagnosis codes? If you look in box 24E, you'll see the letters A and B. So the letter A, M51.16, that's a lumbar disc problem. And then M62830 in the B position, that's spasm of the back. So we're adjusting the lumbar region by connecting those two. Next, 97140 with the 59 modifier, that's pointing and connecting or pairing with M5412. That's a cervical radiculopathy, so we have a cervical problem in position C and D only, right? That's why we have the 59 modifier. The next service procedure of CPT code 97014, unattended electrical stim. It could also be billed as G0283 depending upon the carrier. Where's that connecting with? E and F. E says M5134. That's thoracic disc degeneration, and M54.6 is thoracic pain. And then we're going to do therapeutic exercises where we're connecting that with M5116, again back to the lumbar regions, the two lumbar regions. So that's how you pair your codes through diagnosis pointing. Let me give you another example. Here's a Medicare example with a 98941. So 98941 AT, that's active treatment for Medicare. Where is that pointing? 98941. What am I linking that with? Which diagnosis codes? Well, according to this claim, A, B, C, D. A, M9901, cervical segmental or subluxation. Cervical segmental dysfunction could be interchanged with the term subluxation. M50.32 is also a cervical degeneration diagnosis code. And then in C and D, we have two lumbar diagnosis codes, M9903, lumbar subluxation, And in position D, M54.41, that's sciatica with low back pain on the right side. And I'm also adjusting the thoracic region, M9902, and M4804 is thoracic stenosis. So those, well, actually the cervical and the lumbar region is where I'm adjusting. The traction 97012 is pointing to the two thoracic codes. So that we're connecting those right there, the traction with the stenosis. And then we have one more example here. This is a personal injury example here with 98941, 97530, and massage 97124. Chiropractic adjustment is being directed to the M5127. What's M5127? That is lumbosacral disc displacement. S33.6 is your SI sprain, sacroiliac joint sprain. M54.6 is thoracic pain and your back spasm. So the adjustment is pointing towards those 4 diagnosis codes. And then you have therapeutic activities pointing towards 3 diagnosis codes, M5127, again, back to lumbosacral, sacroiliac, and the thoracic area. And then we also have massage. Massage is being done on 2 totally different areas. Massage 97124, that's linking, pairing, combining with S43.422. That's rotator cuff sprain on the left side. Sprained rotator cuff ligaments, or muscles, I'm sorry, strain. Rotator cuff. So we're doing massage on the shoulder. Patient also has left shoulder pain. That's M25.512. So we're combining the codes on a claim form. We're pointing to them through box 24E. All right, just a few closing comments. Please check with all the carriers you bill prior to submitting claims based on the information in this presentation to ensure that it is compliant. Target coding does not guarantee that the information will guarantee payment from any insurance company or patient. Target coding is not responsible for any insurance carrier or managed care organization laws, rules that may change following this presentation, and you know they change all the time. Do your best to stay on top of these changes. Attend seminars, webinars, join your national and state professional associations. We're going to get to the questions right now. First, just a little bit. Here's our contact information, email, info@targetcoding.com. Website is targetcoding.com. Telephone number, 1-800-270-7044. Our HIPAA secure fax number is 1-844-831-2347. I mentioned earlier a book that had the ortho, neuro, chiro, all the tests to help support the diagnosis codes. It comes from this book, The Best Chiropractic ICD-10 and CPT Codes to Improve Reimbursement. Section on the book on how to pair. That was today's topic. Here's a very detailed version of the 97110. Gives you the clinical rationale, the documentation suggestions, and there are the cervical region, so we have them for thoracic and lumbar and extremities. This also is part of the book where it gives you the long-term treatment diagnosis codes up to about 24 visits, and then we also give you moderate-term treatment diagnosis codes and short-term treatment diagnosis codes, and we have some cheat sheets that break it down, so at a quick glance there's the hierarchy, which codes pay the most. So we have that broken down in the book, and we also have a section on frequently asked questions like, what's the difference between effusion, swelling, and edema? What's the difference between cervical brachial syndrome, cervical radiculitis? What's the difference between spasm and contracture? What's the difference between myalgia, myositis, myofasciitis? So that's also in the book. And back to these supporting, being able to support the diagnosis codes through certain chiro, ortho, neuro tests. Other things that we offer here at Target Coding are compliance manuals. We have compliance as it relates to OIG. OIG stands for Office of Inspector General. Basically, to cut to the chase, if you see Medicare patients, you must have a compliance manual in place. It's mandatory. You need to do it. We offer it. It doesn't take that long to implement. It's about 35, 40 pages of statements and it's your playbook, and we customize for them. We customize them for you through personalized policies and procedures. We give you chart audit tools where you can do self-audits and other instructions. It can help prevent a lot of problems. There's our chart audit tool. It's basically a checklist. Do you have the patient's name in the note? Yes. Date? Yes. Subjective findings listed. Diagnosis codes. Subluxation levels? Yes. All of that is a little checklist. We also offer HIPAA compliance. HIPAA compliance is more important now than ever before because of all the hacking that's going on. I'm sure you know about the cyber criminal activity that's going on now more than ever. Well, it relates right to medical offices and chiropractic offices across the country are being hacked, and you have to take action steps to secure patient private health information. We offer that program too. This is a very comprehensive program. This is a concierge type of program that we offer. We do most of the work for you. There are other programs out there where you have to do most of the work. I look at those as Hondas, which is nice. If you want to buy a Honda, that's great. Wonderful cars. We sell Mercedes. We do most of the work for you. We offer you $100,000 of cyber liability insurance with our program. So shop around if you're looking for a HIPAA compliance program. Ours is more expensive, but you get a lot more. We're with you for an entire year with support. We have excellent videos that your staff can watch. We hold your hand through the entire process. Let us know if you're interested. We do seminars all over the country. We have a whole bunch of seminars coming up. If you're interested to hear me live and in person, check out our website. We do tons of webinars. Most of our seminars and webinars are approved for CEUs. We offer memberships here at Target Coding. We have something called our base membership. It's $99 a month. You can stop and start whenever you would like. And then we also offer a gold membership, which is a very comprehensive one-year program where we review your codes, your fees. We have intense staff trainings and tons of modules that you could watch on your own, and then we do them with you. Unlimited Q&A support. We provide you with our customizable forms and templates. And then we have a platinum membership, which includes a on-site visit to your practice. If you're interested in learning more or you'd like to get a free compliance evaluation, let us know. Here's our contact information again. Email info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044, fax 1-844-831-2347. I want to thank everybody for attending this presentation. I hope you learned a lot.